Hello everyone, my name is Dr. Odebode and I'm with Starmed Medical Education Program. Today I'll be talking about peripheral vascular disease. Before I continue, I would like to give a disclaimer. Please note that the following video is intended for educational purposes only. The content presented is not meant to replace professional medical advice, diagnosis, or treatment. Let's delve into it. In the NAC exams, you'll be presented with a clinical case and you're meant to answer every component of the exam within the allotted time. In this case, it will be 8 minutes. It goes like this. Mr. X is a 50-year-old man who comes into the hospital complaining of leg pain. His vitals are unremarkable, and our task will be to obtain a focused history and perform a physical examination. Be reminded that each task weighs equal marks, so it will be great for you to manage your time well. I would like to start with a brief refresher on peripheral vascular disease. This is a circulation disorder that causes narrowing of blood vessel circulation to other parts of the body except the brain and heart. In this case, Mr. X has leg pain, and that would be where our focus should be. In terms of etiology and risk factors, it's classified under modifiable and non-modifiable factors. This is important because it will help us with our history taking, and it will help us rule out or rule in any important information to help us arrive at our diagnosis. The most common risk factor or etiology associated with peripheral vascular disease is atherosclerosis. Others are smoking, diabetes, dyslipidemia, hypertension, obesity, sedentary lifestyle, and the list goes on. But I just selected these common ones for our information. And we have non-modifiable causes such as age, usually above 45, 50 and above. Mr. X is 50 years old. We want to know about past medical history and family history as well. What are the clinical features someone with peripheral vascular disease present with? Usually leg pain. And the pain is usually associated with exertion. Usually after a few walks or exercise, the pain begins and is relieved with short rest. So we could say the pain is reproducible at the same time in the same location, and this kind of helps us differentiate it from other causes such as neurospinal diseases, for example, spinal stenosis. If in the course of asking more questions, the person tells you the pain is present even at rest, then this is a red flag. We should be thinking of a chronic limb-threatening ischemia. And this presents with air loss hypertrophic nails, shiny skin, atrophic muscles, ulceration, and the list goes on. And these are things we'll look out for in or during our physical examination. Remember, signs are what to look out for, symptoms are what the patient complains about. And finally, we want to have our differentials, because when you are at the door reading your cases, you want to have some list of differentials to help you stay focused. I advise you quickly scribble some differentials such as DVT, neurospinal diseases, diabetic neuropathy in terms of nerves and muscles. And one of the most common components of pain in the leg might be simple trauma. And you just simply ask, do you have any trauma that would give that information if that's the case? And there could also be other reasons, connective tissue disease and the rest. Okay, so with all this at the back of our mind, we can now go into the task of the day. First off, we knock, we greet the patient and introduce ourselves, kind of develop some rapport. And it will be nice to ask, how would you like to be addressed? He or she might prefer to be called X or Mr. X. So you want to note that. And that follows with an open-ended question, how can I be of help? And they will be able to provide you with all necessary information that would help direct you where you should go. If the patient shows any sign of pain or discomfort, usually they are standardized patients, so every gesture should be taken into consideration. At this point, you want to show empathy, offer to give them medication. However, you would want to complete your physical examination so as to get all necessary information before giving the medication. And you let this known to the patient. Now, we go into our history of chief complaint, which is leg pain. You want to know the onset, you want to know how long it's been, some months ago, weeks ago. You want to know the cause, is it getting worse? You want to know what's provoking the pain or what reduces the pain. In terms of provoking the pain, usually exercise in PVD, and when they stop to rest, the pain also subsides. The quality of pain, usually it's a pressure-like feeling. You would also want to know, does the pain radiate? It's not associated with radiation, but it is reproducible by the time they give you the information. And you ask the severity of the pain on a scale of 1 to 10, 10 being a worse pain and 1 being a mild pain. Where would you put this pain? And they will give you a number. Ask them to point at the location of the pain. Is there any time of the day they feel this pain? And has this ever happened in the past? That's for deja vu. Here we want to immediately go over into our associated factors. You want to know if there's any swelling any color changes. They could describe their skin becoming a bit pale. You want to know if there's any temperature change as well, any itching, any change in sensation. This would help give more information. The next thing is, are you on any current medication? This could tell you about hypertension. It could tell you about diabetes, depending on the drugs they tell you they're taking. You want to know if there's any allergies, since you'll be giving pain medication or you'll be giving treatments. You want to know about pain allergies. Past medical history, past surgical history, that could help. And then you tell them you would want to know a bit more about the family. It's nice to always signpost. Do you have any medical condition in your family? And when taking the social history, you want to give a confidentiality clause to let them know that anything we discuss here will be treated as confidential to the extent of the law. And you quickly run through it. What do you do for a living, to help identify any sedentary lifestyle? Or if someone has been immobilized for a long time, you can be thinking in light of DVT. If there's any recent travel and all that, that would also help with differentiating from DVT and PVD too as well. Any form of exercise, which will tell you about the pain, what provokes it. If they smoke, you want to pause so that it does not feel rushed and you do not feel like you're judging your patient. You want to quickly ask about how many packs they smoke per day, how long they've been smoking, and you should tell them to stop, as well as support them on how to stop. It's very important. You want to know if they drink any alcohol, how many glasses, are they on any recreational drugs, and you could end your history taking with 5. Your feelings, any idea what's causing the pain, how has it affected your function, what the expectation could be, and that will just be a nice way to end your physical examination. Now you want to transition into your next task, and you should let the patient know by seeking consent. I will be examining you now, and it will involve inspection, palpation, and auscultation. Is that okay? That way you've gotten consent. You ask for your vital signs for the examiner or anyone in the room, or you run through it. While doing that, you sanitize. It's important to show that you respect your patient and you are also mindful of hygiene. This is very important. Inspection, you want to run through your seeds. You could auscultate the femoral and the aortic broods, looking at the abdomen. And you end your physical examination stating clearly you're going to do the special test, Buerger test, and you could describe it or perform it by raising the leg at 45 degrees. You wait a few seconds, and if you notice any pale or the examiner provide with that information, then there's a positive Buerger. And you complete your Buergers by making or requesting the patient sits, positioning his feet by the bedside, and you're looking out for any cyanosis. And you can state that you end your examination with examining other peripheral organs, the hands, for instance. At this point, if there's any post-encounter questions you'll be asked, they could ask you any question such as what are your differentials, or what is the most likely diagnosis, how do you manage it, things like that. And make sure you remember to thank your patient. Well, I hope this helps, and I wish you all the best in your exams. Thank you very much.